So what are my proposed solutions? And I think I kind of melded this down to three. That, you know, there is far too much waste in overdiagnosis. Medical screening, and, you know, in this book I go into 10 different examples. I use 10 different types of screening, from osteoporosis screening to screening for eyeball pressure, which I used. You know, when you're writing a book, you always need a patient. You need a person to sort of be the narrator. Well, I'm the narrator in the screening for eyeball pressure chapter, because I had my wife dragged me to the optometrist, and the optometrist says, I'm going to do this test where I blow a little bit of a puff of air into your eye, and it's going to show me what your eyeball pressure is. I said, well, I'm glad you're doing that, because I'm writing a book about screening right now, and you're giving me a screening test. And he said, oh, okay. And I said, so what are you going to find with this screening test? And he said, well, I can determine whether you've got high eyeball pressure. Well, that's nice. Do I care? Well, you know, it could lead to glaucoma or other forms of eye disease in the future. I said, well, what's the likelihood of my high eyeball pressure ever going on to hurt me? Well, I don't know. You know, it could happen. So how about some numbers here? Anyway, so finally I got to the point, you know, Mr. Cassels, you're being a difficult patient. Stop asking questions. So what I write about in that chapter is how difficult it is to ask the questions. You know, when someone's coming at you with a screening test, to be able to sit back and say, hang on a second. Before you do that test, I want to know, what is the potential benefits? What's the downstream risks? What are the potential for you taking this reading and turning me into a patient? That, you know, one day I'm just a normal person who went to the optometrist. The next day I'm a guy that's worried about his eyeball pressure. And of course my glasses make my eyeballs look bigger, so, you know, I'm already worried about my eyeball pressure. I would argue also that overtreatment for all of us is a bad thing, but it's really harmful in the elderly. Okay, our parents and our grandparents, the amount of pharmaceuticals and tests and treatments that older people get turn their lives into a lot of medical busyness that never really goes on to help them, and it causes a huge amount of stress in families who have to look after their elderly parents. You know, everyone experiences this at some point in their lives, where your life becomes consumed with managing mom's pills and mom's doctor visits. And I would argue that all of this medical activity would be great if it actually improved the quality of mom's remaining days. But mom's remaining days becomes checking her glucose and taking her cholesterol-lowering drugs and worrying about whether she's going to fall because she gets dizzy sometimes. And so the overtreatment in the elderly, I think, is one of the scandals in our countries, and we have to, you know, do something about that. Again, the same sort of thing, polypharmacy. So, you know, luckily, the idea of polypharmacy, which means taking multiple drugs. So drugs are typically tested in isolation. You'll take, you know, a patient with a certain condition, you'll test a drug in those patients against a placebo, and you'll follow them and see what kind of differences there are. I'm being a little simplistic here, but that's essentially what happens. But when the patient gets out in the community, the patient isn't on just one drug. The patient's already on a cholesterol-lowering drug, a drug for their osteoporosis, one for their eyeball pressure, one for their asthma, and so on. And so people end up getting far too much medicine, and those drugs interact with each other. And I remember when my mother had a heart attack, and she came out of the hospital, and she was like on she was still in the hospital, and she was on about 8 different drugs. She'd only been on a couple before she went in the hospital, but the hospital just kind of threw this armamention of pharmaceuticals her way. And I challenged the nurse. I mean, I'm not a bad person, but, you know, I challenged the nurse. I said, really, does mom need, like, what's this one for? Oh, that's, you know, so they, and finally I got fed up, and I said, can I speak to the hospital pharmacist? And they made an appointment for me, and I went and spoke to and I said, My mother's on like 12 different drugs now, and you know, she was only on about 2 or 3 of them when she came into the hospital, and she just had a major heart attack. Granted that, I would expect her to be on perhaps other drugs, but 12 drugs, I mean, do you know how those drugs interact, what they're doing to her? Like, and the pharmacist says, well, that's just what we do. You know, it was like, what you're asking is a question. You go into a hospital, you're going to be put on a lot of drugs. That's kind of the way it works. And I don't like the way it works. I have my own experience in getting surgery, and as I was leaving the hospital, in addition to getting a script for 100 OxyContin, which I didn't fill that one, but there were 7 different drugs that I was being prescribed. And I realized that some of the drugs were being prescribed to treat the expected side effects of other drugs that I'm taking. And I'm like, really? So, for example, I'm given a drug for GERD or heartburn. It's a pantoprazole. It's a proton pump inhibitor. Effective drug if you've got GERD or heartburn. These drugs work, and they some people get on them and stay on them for the rest of their lives. And I say, I've never had GERD in my life. Why are you giving me this drug? Well, that's to counter the side effects of the NSAID that we're going to give you. Yeah, but I don't have any side effects of that NSAID. So, oh, but you might. Oh, okay. So this idea that you would not even give treatments for things that people actually have, you're giving treatments for people for things that they might have. Anyways, I think there needs to be an awful lot of more pushback when it comes to overdrugging our seniors and ourselves. And I think this is probably the most important thing too, is that, you know, people have to be involved in medical decision making. So health literacy is astonishingly low in this country. People who don't really understand what the doctor's saying, therefore will assume that the advice is good and correct, and sometimes it is, but they're not perhaps literate enough to challenge what they're being told. And I think that doctors are good people. They want to help, and I think that they will answer people's questions reasonably if you ask respectfully. Some physicians will hate being challenged, and then it might be time to find a new physician. Okay, and I think that asking reasonable questions about when you're being offered a test or a treatment is really important. So again, those are. I think I've already had this. Do I really need this test treatment procedure? What are the downsides? Are there simpler, safer options? And what happens if I do nothing? So I'm almost at the end here. You always have to have the Viagra joke. So, Doc, can you write me a prescription for some of that Viagra? And the wife has got the... This is funny, but it's also, in a way, touching in that any drug that you take that affects other people, clearly those other people should have a say in whether that's necessary or useful or even desirable. Okay? So what do I spend most of my time doing? Yeah, hitting my head against the wall. But I hope you guys have some good questions. And so you have to be careful of reading health books, because you could die of a misprint. I always like to end with that. And that's my contact information. My website's not working because my guy hasn't fixed it yet, but...